This. Let's start. Sorry for the delay. I will start in English, and then we'll continue the day in both English and Armenian. First of all, if I can ask you to come and sit closer, because we'll give more space for the people coming in later on at the back. So if everyone can join closer for the beginning, please. Okay, so let's start. First of all, thank you everyone for coming here today. Thank you for waking up early on a Saturday morning and being on time for this day. Thank you to all the speakers that came today and the rest as well who have come early morning. We will see during the day who is coming, and hopefully we will be a little bit more. But we should have already good discussions today all together, and I see people more coming. So let's start with the reason of this event and why we are here all today, and why I called all of you to join us and have this discussion. First of all, it's very important to understand that this type of event has not been done in Armenia before, and therefore this is the first time that we can organize a health innovation conference only focused on this topic. We have many conferences in medical field, clinical training, education, expo, but gathering everyone on the topic of innovation only was not done before. And that's why we thought, okay, let's do it. This is our topic. Let's gather as much people as possible and have this, initiate this conversation. So first of all, it's important to understand from our perspective that health innovation is critical to ensure a healthy nation. If we don't have health innovation, we cannot have a healthy nation. And we will discuss during the day what are the different sides of having a healthy nation and a healthy health system. Today, we're here to share, to learn, and to grow all together. We're here to innovate together. We will speak honestly about our problems, different solutions that have been invented, and the challenges. Why I put honestly in bold, capital, underlined? Because most of the conferences I've been to here, since I'm here, are not fully honest in the way that we don't speak the truth. So I want today that all of you, as much as possible, speak the truth, speak what you feel as a citizen, as a patient, as a health professional, as an innovator, about what you're going through, what you have done, and how we can go forward. When we announced the conference, we didn't have the program because we had to build it with everyone, and there was a little bit of suspense about what it will be about. Many people thought innovation, okay, that's another AI conference. We'll speak about AI, technology, and so on. So yes, we will speak about AI today because at this point we have to embrace the AI revolution, including in healthcare. But innovation in healthcare actually is not that much about technology, because we can have a lot of technology, but if we don't apply it correctly in new systems and new processes, there's no point. So today we will have a lot of presentation about organization and people creating new systems, improving or updating systems and processes. And this is the most important, maybe key message of today, is that if we want to change and innovate, we have to update our systems. Systems, it is first of all system of thinking, mindset, and then systems of self-organizations. So today we create a community for health innovation and a community dedicated to improve our health system. We will have 10 sessions, 45 speakers, and most of the speech will be short, around 5 minutes, and some keynotes about 10 minutes, and some longer ones, 20 minutes. We chose this format, first of all, to be as much dynamic as possible, but also to cut off all the noise that people add onto slides to make it nice. So what we ask the speakers today is focus on what you have done, focus on your challenges, and share with us what, how we can work all together. The different sessions are built around policy, prevention and promotion, primary care, workforce development, diagnostics and labs, hospital and clinics, investment, digital health, research, and communication. Hopefully, by the end of the day, there will still be people to speak about communication, but let's see if we're still a little bit, it will be still okay. So we planned a long day. I know it's not common for Armenia, but that's how we innovate as well, trying to change with new standards of event. We'll have three breaks, and 1 hour lunch. The program is online. If you want to scan it now, this is the time, because then we will not have sharing again. So you can scan it now and keep it for the whole day. Okay. If you want to share some pictures or comment of the event online on social media, the hashtag is VickinoDay, the tag is Vickino, and feel free to share whatever you feel. The team today with me, we have Lyudmila, Ani, and Hasmit, who are at the back. So if you have any questions during the day, you can reach out to them or to me if I'm busy. The sponsors of the event, we have today Amaros, which will give a presentation in the afternoon, and also Eurolab. So thank you for them in supporting this event. And so let's start the day. First of all, for those who know me and seen some of my presentations, you know that I like to start with some engaging conversation to bring people in the topic and not fall asleep from the first 5 minutes. So first of all, I will ask you questions, and if you agree, you will do what I suggest. So first of all, if you face any problems in Armenia for your own health or for a relative, please raise your hand. Okay. We have problems, that we know. Second, if you believe, and the word here is believe, that we together can improve the Armenian health system together, then please stand up. Yes, one time is hand, one time is legs, just to be active. Okay, so thank you very much. We all believe we can do. Let's see what we actually can do. Now, if you are ready to work personally to improve the Armenian health system, again, raise your hands. Okay, good. Last point, because it's about collaboration. So if you're ready to collaborate with other people around, please shake your neighbor's hand and start the day with a good collaboration time. Okay. So we all agree we can all work together now and start our day. All right. So this is fun activities just to show how we do ecosystem building and the goal of making people warm and friendly together. If we don't know each other, we isolate it and so on. We cannot break the problems together. So how we think about VickinoDay, for us, it's a long-term infrastructure for health innovation. Today is the first day. We'll see in a few years how it goes, but our commitment is to do that. And Vickino, which is the company I founded 2 years ago, our goal is to be the catalyst. So that's why we welcomed you and invited you, because we want to bring the energy and make everyone working together. This will not be just a one-day conversation. This is a multi-year commitment to building national capacity for health innovation. And capacity here is important. It's not just individuals. Why are we here today? We're here today for Armen, Nare, Anush, Tatul, and Aram, not for us. We're here for them because what we do in our work today is about our population and our country. This is AI generated, but it's getting much better and better. I didn't have time to go to all regions to take pictures. Okay, any questions about the format? No? We're all set on the agenda? All right. So, first of all, we'll start our first session about innovation in health policy. We will have 3 keynotes. We'll set the tone with a first presentation. Then we'll have Tigran Bashan, who's head of Amelia Management Advisory, and it will be followed by Jana Arutunyan, who's a National Professional Officer in World Health Organization country office in Armenia. Let's start with first keynote. I promised I speak a lot at the beginning, but after it's your turn. Okay, so a strong Armenia begins with strong Armenians. If we're not strong, we cannot build a strong country. That's not seen anywhere else. Now, sorry. A strong Armenian begins with healthy Armenians. We cannot be strong if we're unhealthy. So we have to understand what does it mean to be healthy as an individual and as a group, as a country and as a nation. And a country that can't protect the health of its population, how can we expect to protect itself from external aggressions or internal decay? So today, our country is in crisis, and our nation as well. And I tried to reduce the list because I had a longer list, but I just wanted to focus on the main one, according to me. First of all, we have demographic decline. Our population is very small. Most of our nation lives outside of our country. We're aging and in unhealthy situation. We have democratic decline in the past years. Social inequities are rising between different socioeconomic levels. Territorial loss, big divisions within our society, and apathy. That's why I'm trying to make you not in apathy stage today. And in addition, we have a kind of failed health system. I'm very strong here with my words because I said I want to be honest at the beginning, and this is how I see our health system. If we have failed system, we cannot produce healthy Armenians, and therefore we cannot produce healthy Armenians. Why do I say that our health system is failing? First of all, it's severely underfunded. If we compare to other countries, even within post-Soviet areas, we have very low funding from the state to the health sector. The health insurance reform will increase this funding, but still it will not cover the need of what we need. Secondly, the health system is plagued with fraud everywhere at all levels. Thirdly, we have high out-of-pocket payment, around 80%. We cannot have a country where 80% of spending is from our own pocket and leave people who can't pay dying. On the governance way, it is under-regulated or sometimes too much regulated, but with old regulations that do not make sense anymore or out of logic. It's mismanaged, and overall it's of mediocre quality. In addition, there is lack of transparency. We don't know what's happening. Where are the data? Where is the money going? What are the outcomes? How many people are dying from this or that disease? We don't know. We have some data, but it's not perfect. Lack of collaboration, that's why I invited you all today, and lack of innovation. I didn't want to do a public health presentation, very technical today, because it's not a public health conference, but just key data. First of all, 50% of men are active smokers in our country. This may be the normal here, but it's not. So until we keep that level, we cannot have a healthy nation. This number needs to go to minimum like 10-15%. Until it's still at 50, we all together have failed. Period. No discussion. That goes 5,000 deaths per year, as per WHO estimation. Per year, not in 1 month, not in 45 days, per year. And we have a very high incidence of cancer. If I add on to the list, the alcohol consumption in our country is skyrocketing, very high. This is not cultural, this is wrong behaviors. Drug consumption has increased drastically in the past years. There's all the data for that if you want. Addiction is rising, and as you all have experienced, our country is heavily polluted, whether in Yerevan from air pollution or in the region from water contamination with heavy metals, or in our agriculture with high use of pesticides, which is killing us every day. We cannot continue like this. We have to change. And health is power. So we need to fight our enemies. And it's not one person. It's a system. The system we're all contributing to and not changing. This system is characterized by mediocrity, bureaucracy, passivity, laziness, and lack of punctuality. I added this one for today's sake. So we need to innovate. We cannot stay like this. It's not possible. We have to change. It's not optional anymore. This is a necessity. We cannot stay in the same area that we are. So now, why are we here today? Why I'm here today? 3 years ago, I repatriated to Armenia. I was born in France. And my goal was to build my country every day with a national vision. This includes art, music, civic engagement. You can see all of that in my personal website there. But most of all, professionally, through my health expertise. So in 24, I launched Vickino with one objective: to transform health of Armenia, working daily for it. So health innovation is about health system, and at the core, one part is digital health. What we do different services from academy, auditing, strategy, execution, and evaluation, working for the health sector only. We work on different approach from public health to health industry, providers, and payers to cover the whole system. Today is Vickino Day. So what I did, I gathered the builders, those who believe we can, and you all stood up, so we have the right audience. Those who work relentlessly every day, and those who refuse decline. in one word, the builders who defend our future. What is the vision? Just a few examples for you to imagine what we could have. A healthy nation, life expectancy of more than 85 years old. We just have to work on that. It's not just crazy thoughts. Tobacco-free. True universal health coverage. We're on the way. Real-time population health data. We don't have it. AI-powered, transparent system. And also being able to export innovation. In one word, a global hub for health innovation, the same way that we're trying in the tech sector to transform Armenia as a global hub for tech innovation. So today we have our nation builders, our health innovators, and they will show us their vision and the way how we go to that stage. So let's innovate together in health, and let's build a strong Armenia together. Thank you very much. Let's make today a milestone and go forward. Thank you.